We're live. Hi,
Yeah,
everybody. I almost said it's Karen Anderson with Week in Review, but it's not. But it is
it's
Karen
not.
Anderson. It is Karen and my sidekick.
Oh, Terry Cook.
Yeah,
Hello, everyone. Good evening.
it's the Terry and Karen show. No, it actually is not. It is our Ask a Doctor event. And I really think that this format is so super, super fun. So we used to do this strictly on Facebook for many years, if you guys are familiar with Aortic. And Dr. Siddharth Prakash from UT Houston, and his bio is all in the event information. God, he's so generous with his time. He gives us every other month about 2 to 3 hours of his time where he answers questions on Facebook. And then we had him come live and we tried that format on YouTube. And now we're like covering all bases. So we have started posting questions in the Facebook post that I will read to you as he answers them. And as you post questions here, we will be typing them in the Facebook post and I will be reading you the answers here. So, so we're like covering all of our bases, which is kind of fun. So I need you guys to please click subscribe, click the little button, the bell, so that you're notified every time we go live with these kinds of events. Matter of fact, we have one tomorrow night. Diane Bishop, the aortic artist, going live at 7 p.m. She's going to be going over brushstroke techniques and different bodied acrylic paints from light to full bodied. And what does that actually mean? Because I have no darn idea. So she's going to be doing that. And we're going to be learning how to paint simple brushstrokes with her. And let's see. So one of the other things I need you guys to remember is this YouTube channel, it's super duper public. So is our Facebook page. Anything you chat here or you post in the Facebook page can be seen by everybody, which is awesome because that's the whole deal. We want people there's a degree of awareness, there's education that's happening. But if you want to remain anonymous, there is a link that should be in the details of this post that gives you that anonymous question form. Right. So you can click on that. It's also in the Facebook post and your question will be submitted to us. Now, anything I read on here from Facebook, I'm not saying names. I'm just reading the question and the answer. And anything that comes in the anonymous or comes in the chat, I'm just reading the question and reading the answer. So, but it is still here. And as we send links to different places, it's going to get pulled up. And as we hope you guys share this, it gets spread around and you get the idea. So, that. And
That was a lot.
it's a lot, right, to get
That
started.
was a lot. Exactly. That was a lot.
I know.
But
I know. I'm stir crazy. It's like the end of a very long day.
yes.
And I've just had so many interesting things happen today. And yeah, so I'm buzzing. And then I still have support group meeting tonight at 10 p.m. Eastern, which is 7 p.m. Pacific from our friends out in California. So we hope they're faring well. Fingers crossed
Yes.
that these new winds don't whew,
It's so
erupt.
scary.
Yeah,
It's
more
so
damage.
scary.
It's
Yep.
really horrible. So yeah, you've been diligently being a little typer yourself. I'm sorry, I'm eating a Dorito. Don't tell my doctor.
That's all right. I'm still trying to find where I get the anonymous posts from.
Or what?
The anonymous post. Oh, I think I found it. I think I found it.
I don't understand.
Okay.
No, you just post as you or as aortic hope.
Yeah, no. Like if there's any questions, I found it.
Oh, Josh is
I
going to
found it.
pop it in the chat, so you'll get to see it here.
Oh, so I don't need to go onto YouTube. Okay. Sorry. Okay, go back.
Okay.
All
So
right.
it wasn't pinned. I'm taking this off. Um, I'm going to go pin something. So hold on. I'm going to manage this so we can get this pinned to the top, and then we can talk about.
Oh,
Yeah,
I
I
thought
got
I
it.
okay, I thought I
It's
pinned
in
it.
my thing. I'm on it. I'm on it. I'm just on it.
Don't yeah, don't say it. I knew what you were gonna say, but I'm very technical. Yeah,
Are you
I'm challenged.
Technicolor?
I'm challenged.
I think we
I'm
both are
challenged.
tonight. I think we both are. So what is happening, just so you guys understand, is first I'm gonna have to take this off. I can't put this link on. What's happening, that was weird, is we've got questions coming in. You're typing questions into Facebook. We're waiting for answers because he should be joining us any minute. He's actually there. This is awesome. All of your questions are going up as Terry. You didn't make it aortic, but it's totally fine. You just might have a lot of questions tonight.
That's fine.
So yeah, so we've got questions and we're already getting answers. The doctor is in the house. You guys can start posting there and you guys are open and free to start posting here in the chat. All right. So, first question was, how often should children of aortic patients be scanned for aneurysms? That is a good question. Now,
Hmm.
to clarify, we did not say if it was adult children or like pediatric children. So I'm going to put a caveat in there, or you can. But Dr. Prakash says the frequency and type of scans, it really depends on several factors. So the diagnosis of the parents plays into this, the age of the children, and whether or not the last scan was abnormal, all key important factors here. So there's really no one answer that works for everyone. So you always want to consult with your doctor if you're uncertain about when their next scans are due. I do that. I do that because I'm like one of those, helicopter moms. And I'm like, is it time for my son's scan? But again, it all goes into really the age that the parent was when they had an event or they had a diagnosis. And then there's a calculation based on when they think your offspring, we'll say that because that covers children of all ages, when your
It,
offspring should be looked into.
yeah, and isn't there something about 10
10
years?
years.
Yeah.
Yeah.
So like if you're 42 when you dissected, your child should be screened again at 32.
Yeah, no, I don't subscribe to that.
You don't?
No,
Okay,
no.
never mind.
No, because, and let me tell you why. I'm just gonna tell you my own situation. Not that it's anything that's hellacious, but I was 44, 45 when I had a dissection, and I brought my son in right away at age 15 or 16, and we discovered that he had a slightly enlarged aorta. Might not be because he's 6'4" and he was pretty, thick
Hmm.
then. He's lost weight. Um, but it was slightly enlarged, and one of his chambers of his heart was enlarged, which was indicative of hypertension. We didn't know he had hypertension. He's not one that feels it. So I am so happy I brought him in.
Hmm.
And he put him on medications. He didn't go back for like, I think he just went back. So that was,
Hmm.
where he went back once in between. So it's like every 5 years.
Yeah.
And at least I know he's on radar. At least I've got things to compare against. You know what I mean? And everything's stable. So I am
Yeah.
happy.
No, I agree. I agree with that. I
Yeah.
mean, my son, I already took him as well. He already had an EKG. He has, I'm not EKG, an echocardiogram. He has a baseline. So he'll go
Yeah.
back, I think he was 18 or 19. And he'll go back when he's 25 in a
Right.
few more years. Hmm.
Exactly. So I don't know if I would be comfortable with the 10-year
Correct. I agree.
calculation, but
Because we're talking our children, and they're everything to
meow,
us.
mama bears. All right.
Exactly.
Should those of us with hardware, like mechanical valves, stents, grafts, that kind of thing, should those of us with hardware automatically start seeing infectious disease doctors? Maybe that's an important thing to consider, like another tool in our tool belt, right? I think that's interesting. I've never seen an infectious disease doctor, so I've seen every other ologist. I definitely did that in my repertoire, but so Dr. Prakash says definitely not. Most people don't have a high risk of getting an infection. So even after dental procedures, that risk is not high. Ordinary antibiotics work for almost everyone without a need for a specialist. So that's one less ologist I have to see. Right?
That's correct.
All right, let me refresh and let's see what we have going on. La la. Okay. You're still typing as Terry, just letting you know.
Yeah,
I
I
like
know.
just an FYI. I posted these, but they're really from other community members. Okay.
Yeah,
All right.
I don't know
That's
why I'm
adorable.
still posting as me,
I don't know.
but
Got
that's
to click
okay.
the little head. All right. So please explain vasculitis in relation to aortic disease. This is a really good question because I'm hiding my drink of shame.
I
It's a
have
mini.
water. I have
Well,
water.
you're better than me.
No, I'm not.
All right. Vasculitis means inflammation of a blood vessel. It's a really big fancy name for something that sounds like it's really small. So it can be caused by some autoimmune diseases. In most cases, this does not lead to aortic disease because it tends to affect smaller blood vessels versus large arteries. But there are rare types that cause aortitis, which I think we did talk about in the new book. It's a type of aortic inflammation. Those types of vasculitis can lead to aneurysms or dissections of the aorta. So we can diagnose vasculitis using specialized blood tests or special stains of aortic tissue that's removed from the body after an aortic operation. Frequently, that's how aortitis is diagnosed because it might be hard to recognize unless the doctor is suspicious. Well, in that Isn't that a fancy thing to do and talk about? Aortitis.
That's a big word.
It's not as big as oh God, colic. You know what I'm trying to say. I'm not
Yes,
even
I
going
do.
there. Forget it.
And yeah, forget it because that'll just be your word forever and ever and ever.
Colloquially, or spironolactone. That's a big one too.
I
That's
know.
a big one.
There was
All right.
one, there was a drug that I was put on when I left the excuse me, when I left the hospital after my surgery, and
Yeah.
loaded no, you're supposed to be loaded up with it. It was I could not say it for the life of me. I
Metopolo,
no, 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 no. It started with an A.
amlodipine,
It might have been amlodipine. I don't remember what it was, but it was
Norvasc. Yeah.
yeah, I could not say it. Every time I talked to like a physician or not a physician, but like one of the nurses, I
Right.
couldn't say the word. It was horrible.
It happens.
It does.
It does happen. All right, here comes some more. Let's see. All right, we talked about that one. Hi. uh, Dr. Prakash said, I figured it out. These questions weren't all from you. All right, here
Uh-huh.
goes one. So, pre-meds prior to dental cleaning. This is a debate because I do not take any pre-meds. Of course, I have my original valve, but I've never been told that I needed
Don't
to
either.
pre-medicate, right? No.
Correct. I
So,
was told I didn't have to.
right. So, should aortic, I think when you say AD survivors, I'm guessing it's beyond just aortic disease, probably dissection. Should AD survivors in general with lots of hardware have to be more aggressive with an antibiotic pre-med than the typical 4 antibiotic dose, which is given 1 hour prior to a dental cleaning or treatment. This particular person's infectious disease doctor indicated that they should be that should all be based on graft stents and artificial valve that this person has installed. So have the protocols not changed to keep up with survivors? Um, and here's that interesting answer for you, community member. Most types of grafts or stents are not considered to be particularly susceptible to infection because the body covers them naturally with a cell lining after implantation. That's interesting. We do not wait. We no blah, blah, blah. We do get concerned about infections of heart valves, particularly aortic valves, and do prescribe antibiotics for some people who have prosthetic valves. In most cases, the risk of getting an infection from a dental procedure is very small, even if you have multiple implants. I don't
That's
know
good
if
to
that's
know.
going to be, it's good, but I don't know if that's going to be satisfying.
But never mind, I'm not a doctor, so I have no idea. But
I know
I thought that you definitely had to take pre-meds if you had heart problems, which we always say the aorta and the heart are two different things.
they are. Yeah,
So in a way, I can understand, but I know
I
I never
guess.
take medications. I don't get pre-meds.
Mm-mm. Well, I would only
Mm-mm.
take like Xanax.
Yeah. Well, and I
That's
even
it.
remember it was a question that I asked my cardiologist, and she actually had to call someone because she wasn't even sure. She called,
Mm.
someone that knew about aortic dissections, and they said I don't have to pre-med or
I don't have to
pre-medicate.
pre-med.
Yeah,
No
I know.
pre-med for me.
No,
Okay.
thank goodness, because it's
Oh,
torture enough going to the dentist.
all right. Let's see. Da, 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 da. Here comes another question and comment. All right. And just so you guys know, Dr. Prakash, as I mentioned, he's again so incredibly generous. He will be on until probably 8 or 8:30. Always a chance he goes longer. Eastern time tonight. We, unfortunately, your entertainment your entertainment with a twist. Your moderators with a twist. Your whatever
There you
hosts
go.
with the most. Hostesses with the mostesses. We
Mostesses,
will only be
exactly.
on till 7:30, so you only get us for a little bit. All right, here comes another question and an answer. So this particular person has 9 people. Listen to this: 9 people in their family that have either died from aortic dissections or have 4.2 centimeter aneurysms or larger. That's a lot of family history,
That is a lot of
right?
family history.
Here's the person's concern. Let's follow this. Their 22-year-old son was born with bilateral
Not sure what
choanal
that is.
choanal atresia. Mm, choanal. It could be a very different word depending on the emphasis of the syllable. I have no idea. But this person believes that is excess connective tissue, maybe. So maybe we need an explanation what that bizarre, funky word means. They've also read that 17% of babies with this condition have heart issues. This person, the son, has had 12 surgeries to open
Wow.
him up. His last one was a sinus surgery at age 12, so it was like 10 years ago. Then in 2022, when he was 20, he popped out his hip while playing basketball.
Pickleball.
I'm sorry, pickleball. It was a ball. It was a game with a ball. Pickle, basket, foot, I don't know. He stopped short and it just popped right out. So when recently he passed out while waiting to get a drug test for a new job. He did have a fever. They couldn't find anything, not even strep, nothing. His father, who passed in 2022, so sorry, that's very tragic, used to get lightheaded frequently in the shower. And they believe this is a sign, but the rest of the family blew this person off. So he's being seen the first time on January 29th. Is there anything that they should be asking of the physician? That's very interesting. So let's learn a little bit about this. So
Well,
Dr. Prakash says, I understand why you're concerned. Did anyone in your family have genetic testing? It sounds like aortic disease runs in your family. Current genetic test panels can find the causative gene in families like yours. And if a genetic cause is diagnosed, affected people in the family can be picked up before they even develop dissections and have a life-saving treatment. So the Marfan Foundation and the John Ritter Foundation for Aortic Health both have resources for families who are interested in genetic testing. And you can actually go directly to the John Ritter Research Program for Aortic and Vascular Health. That is one heck of a title. And they are the arm working in UT Houston, University of Texas Houston, doing the actual genetic testing. So it is out of UT Houston, and they are allowed to. This arm is allowed to be called the John Ritter Research Program for Aortic and Vascular Health, and or research rather, and they can actually help you with that. And if you want more information about how to get in touch with them, you can go to our resources section on aortacope.org. If you scroll down through that page, you will see information about the John Ritter Research Program, and all of the contact information should be in there. Okay. Where's the next one? Uh-uh.
there's
Okay.
several out there.
La la la. We talked about vasculitis. Okay, I think we've talked. Am I missing one or
Yeah,
anything?
there's one.
Go ahead and read
uh,
it. Take it away while I chew on a Dorito.
yeah, there's a lot of them. But he has not answered. Yeah. Oh, here we go. What does it mean? IFC filter got mild. Oh, geez, you want me to do this? I can't read this stuff.
I'll do it. I like that word.
Go ahead.
All right.
I'll read the easy ones.
Okay. I didn't see that. I don't see it. Da, da, da. Oh, what does it mean? The IVC filter got mild atherosclerotic calcification. And how do you get rid of calcification? If I'm not mistaken, and I'm not a doctor, but I'm going to see if I'm correct. IVC filter is put in when you have blood clots and it traps it. It goes in
Okay.
like right around the groin. I think I could be right for 200. This is the game I should be playing with Tara Cohen, EVP from Lawrence Hope, because I would win. Let's see. Am I right? He doesn't say, but I think I might be. Accumulation of calcium in blood cells on an IVC filter is normal, and it's not necessarily a cause for concern. It's part of your body's reaction to having the filter in place in the first place. You may want to ask if you need treatment. Some filters stop working after a period of time and they need to be exchanged or removed altogether. So you really can't get rid of calcification. I guess it's a good thing. It's capturing it, it's filtering it, it's holding it there, and when it's time, if it needs to be removed or replaced, the physicians will tell you. Want to take it away for the next one you want to do?
Yep, I'm looking to find some answers. Oh, here we go. Is there an increase of right-sided aortic arches being discovered? If so, are they more likely to cause aneurysms? I needed aortic surgery at 23 years old.
Hmm,
Dr. Prakash says, yes, we and others have shown that abnormalities of the aortic arch, like a right sided arch, are more common in groups of people who had aortic aneurysms or dissections and are frequently accompanied by other types of congenital heart failure or congenital heart and blood vessel abnormalities. In some cases, they were caused by specific genetic variants that also cause aneurysms or dissections. That's very
okay.
interesting.
That
See,
is very interesting.
the more we know, the more that the doctors know and can research.
That's right.
It's amazing.
So
It's
that's when we
amazing.
talk about this big initiative in 25, a senior healthcare journey. When we really get into the nitty gritty of how to advocate, communicate, and educate, it's not just your physician because it becomes this spider web. Because the goal is we want our physicians through our communication, our comfortability in advocating for ourselves and educating them, we want them to take that information and now start researching things for us, talking to other physicians for us. So then they are advocating, communicating, and educating for us to other people that are part of the team. It's just amazing. What a
It
thing to
is.
come up with at 2
It's
a.m.
amazing. I mean, even
instead of shopping.
you are so funny. It really is. I mean, even just the almost 4 years now that I've been in aortic hope, and I've just so much has changed, and
Yeah.
they found so much more. It's amazing, and we need to
Yeah.
keep acing our healthcare and advocating for ourselves.
Yeah. I do have a question. If you want to type something in, I could. I can do it.
Okay, I'm
Oh,
still
we've
waiting
got a
for some
couple replies
replies.
here. Yeah, I'm seeing some replies.
Yeah, me too.
Mm. Oh, that condition that that person was talking about, the nose was pure bone on the inside.
Yeah,
Oh, wow, interesting.
yeah, and he
Kind of
asked
learned
about
something new.
yeah, he asked about the genetic testing as well, and she said
Mhm.
everybody was negative,
Yeah,
which again, the more people that test, the better chances
we
they find
just
stuff.
yeah, which again, we're still at about an average of 70% of people with aortic disease, and that again is valve aneurysm all the way anywhere from root to the iliac, right? We're talking about the whole entire organ.
Yep,
70% don't know why.
that
So,
is correct.
yeah. But it's only about 20, between 20 and 30% that have a known like connective tissue disorder or CTD.
So, so here's the thing, a
Yeah,
question I have, and I don't, this is just a random question. So you say that people don't know why they dissected,
right.
but okay, so in my case, we found out it was hereditary.
Hmm.
But is that really a reason, or is there, I'm wondering if there is
Yeah,
something else. If there is a gene that maybe my dad had that I have,
good.
that's why,
Right.
right? So
Well,
it's, yeah, I
yeah.
figured it out because it's hereditary, but there's got to be more to. I think there
Well,
would be more
this
to
is
it.
a good question. Write down, say, what is the difference between something being something happening because it's hereditary or genetic? How does AD work in this with those specific words?
Look at
Is
that! I
it
just
truly
came up with my own
hereditary?
question.
I'm proud of you. I'm proud
I
of you.
know.
Yeah, because that is really interesting. Um,
Hmm.
because was it the genes?
Right.
Yes and no, chicken and egg, because it was probably high blood pressure that was uncontrolled that triggered a gene that then turns on, and then this happens, but it's still high blood pressure because there may not be a genetic reason for the high blood pressure, except you ate your way to high blood pressure and drank your way and smoked your way.
And
So,
smoked.
like,
Right.
who knows, right? There's so many different reasons. All right, while you're typing, here's a question. This person started testosterone hormone injections months ago, but has maintained a very stable BP, still in the 120s. So, is there any harm if this is helping quality of life in that area? The dose is small, 12 millimeters or something. I don't know what that means, but testosterone has profound effects on the heart and blood vessels that we are just beginning to understand, is what Dr. Prakash says. Currently, there's really not enough evidence to show that testosterone helps or harms regarding aortic disease. But as this person mentioned, it can raise blood pressure in some people, and that can increase the risk for growth of aneurysms or development of dissections, but it can also affect the risk for blood clots. Um, we're currently working to gather more evidence about the risk of testosterone for people who have aortic disease. But until then, I would proceed cautiously and be sure to have your aorta checked regularly. To that point, women and HRT, hormone replacement therapy, very different set of rules, I believe, for people in the aortic community, especially if you've had TIAs or you have a history of strokes. in your family because hormone replacement therapy, even for women, can increase the chances of having a stroke. So you may want to try a product that impacts you minimally, if at all, like estradiol for women, or look into Intrarosa. It's another drug. And just talk to your physician about that. And you might need to have your levels checked to make sure you're not absorbing and you're having your own hormone levels increase, because that, again, then I think puts you at risk for stroke. But I'm not a physician. I know not what I speak of, except that I know people in the community and this is what they've said they've gone through. So I'm just sharing experiences here. But
Karen, I
yeah,
tell you all the time, you really need to go back to school and get your doctorate or your
here's
PhD.
here's why I can't.
Why?
Because I don't know what I had for breakfast this morning. I don't retain. I have to retain things that I find very interesting. And if I get
This
to the
is,
part, what if it's the part that has to do with proctology? I will not find any of that part interesting. And it's like when you become a doctor, you don't get to like say, "Well, I don't want to play with somebody's eyeballs. I'm going to have to dig into eyeballs, and can't do that because it's looking right back at me." So I can't do it.
oh my
I
God.
could be a tech. I could absolutely be a tech. But then there's just jobs. God love those techs. I swear that I would be like, I cannot. I cannot delve into all of that and clean all that or have it on me. And just like,
Yeah, yeah.
But
But
if you want me just to take vitals, I'm your gal. And I would love that. I would enjoy that so much.
but here's the thing, actually,
Yeah.
honestly, at our young age, why
Very
bother
young.
doing it now?
No,
Because
because
we're
I,
almost done.
yeah, I
Well,
don't need
yeah,
to.
yeah, exactly.
Uh,
Neither do I.
yeah.
And I
I
love my job. So
Well, I love what takes up the time in my day too. All of
that,
you guys.
that's correct. Well, I say all the time, I have two full-time jobs. I only get paid for
Yeah.
one.
No, you get paid in ways that money
I was
cannot
just, you beat me to it.
quantify.
I was going to say that.
I'm serious.
I
All
know.
right, let's go in. We've got a couple others, I think. Look at all these new questions that have come up. This is awesome. Oh, Tammy's so sweet. She said, Dr. Prakash, thank you for your time and expertise. It's so important to provide current and accurate information to the community. Thank you for being available to make a difference in our understanding of aortic disease. It's very sweet. All right,
It
did I
is very
miss?
sweet.
There's so many great questions coming in right now.
Yes.
And we're just going to have to, you know what we're going to do? We're going to take our commercial break
Okay.
and we're going to talk about some swag that we have. Can you see this? This is our Aortic Hope decal. It is it's so nice to be able to put this on a window and know that you can peel it off if you want to with ease. These are awesome. And this will come to you as a thank you with a $5 donation. Five. If I had all of my friends give $5 to Aortic Hope, what a glorious day that would be, right? If I had half, if I had 1/4, I would be like, this is just magic. This is magic. $5, you can have a decal. And you know what? I'm telling you, it's the logo that gets them every time. It's the
Yeah.
icon right here. People
Yeah.
always ask, what is that? Tell me about that. What
Right.
is aortic? What's an aortic? That's the good ones when you get
What's
that.
an
I'm like,
aortic?
right.
Well, and
That's the good one.
here's a little plug for the decals as well. So I bought a new car recently and I hadn't put one on yet. And then of course we had all the snow and crap and my car was filthy dirty. I was like,
Yeah.
well, I can't put it on right now because I couldn't find my Windex. So I went to the car wash. I had it in my purse. And
Yeah.
as soon as I came out from the car wash, boom, smack that thing right on there. And since the car's kind of new and it's totally different than I've ever had, I do have problems finding it in the parking lot sometimes.
You're
So
so funny.
now I don't have a problem because I have a decal on it.
And because your car's so new, sometimes I don't recognize it. So when I see you like drive by and I can't see you
Right now
because
you will.
you're like your wheel is up here and your head is down here. I
Not in this
but
car.
boom.
Not in this car.
I see your magnet. Oh, let's talk about that. And I see the decal and I'm like, oh my goodness, somebody has our swag. And then I realize it's you. It's
Oh,
so
it's
exciting.
Terry.
It's so exciting. Hey, this is the magnet I'm referencing. We have had these for a long time. We actually
Yes, we have.
created this awareness ribbon, which incorporates the icon in it. I mean, this is great on a car if you still have magnetic areas, because what's happening is new cars are down to the gas cover and someplace maybe on the trunk. It's so bizarre.
It
But
is.
if you work and you have a file cabinet, this is great to put on the file cabinet.
So you know where I
Uh,
have one?
$10 donation, and this is yours.
I
Where?
actually didn't even realize that the other day I was going to put that on my car. And I was like, "There's probably no metal in my car." So you know what I did?
Where'd
I
you
just
put it?
stuck it I stuck it to the back of my front door.
Hey,
It
it's a
works.
place.
It's a place.
People I know people who have donated and received a couple of these and just stuck them on the back of ambulances. Just walked by and said, "Smack."
Yep.
It brings it to their attention. You know,
Yep.
they did it too with think aorta magnets, and those are really long, but these
Yes.
are really cute and eye catching. So all of that you can get. There's a form underneath our Hope Shops. If you scroll down past the books, you will see there's a form with a picture of the next product we'll get to in a little bit with our belt covers. And you just click on that form and you can go ahead and place your little order. And that's our commercial break number one. I did that. Best timing too. 7 o'clock. All right, look, we've got
Exactly.
questions and comments. Let's divvy these up, girlfriend.
All right, let me refresh and look what's
Oh,
here.
instead of most relevant, let's do newest. Let's put in an
That's what
order
I'm
at
yeah,
newest.
I'm doing it in
I
newest.
totally forgot to do
Oh, I
that.
do all comments. Yeah, let's do newest. Let's do newest and let's see. Oh,
You
here we
take the
go.
first one.
I've been told to pre-med for decades before AD repair due to mitral valve prolapse. After the AD emergency surgery, I was told to pre-med to avoid endocarditis. In light of the fact that antibiotics wipe out the gut microbiome, making us more
Microbiome.
susceptible to infection. Is that still recommended to take antibiotics before dental cleaning? Again, this is the dental cleaning one.
Mhm.
And he says, in most cases, a single dose of antibiotics before a dental procedure will not wipe out your gut.
Yeah.
I can't pronounce that word. Antibiotics are still recommended because they do prevent a potentially devastating and life threatening infection while having few side effects.
Mhm. So
Next one. Oh, go
everybody's
ahead.
everybody's gut has microbiomes in it, little bacteria, good bacteria. Would you know that every single human being I did here, everybody's bacteria in the gut is completely different.
Oh, I'm
No
sure.
two people have the same gut bacteria. And so what happens is you can imagine you're on like Augmentin, some hefty antibiotic, it wipes out your bacteria because it's wiping out everything, trying to get rid of
Right.
infection. That's why sometimes you can get really dry, your nose can dry up, your flora changes, your pH, everything gets off balance. And
Interesting.
that's why they say take a probiotic,
Probiotic. Yeah.
which is what you would
Interesting.
take after, right? And prebiotics are what you take like before you eat, and pro is after. I think that's how that works. Because you want to keep bringing in good flora to your gut.
Correct.
But when
Correct.
you just do a single dose of however, 1, 4, whatever it is, like Dr. Prakash said, that really shouldn't wipe out any
Yeah.
of your, you know.
All right.
Okay.
This next question is a good one.
Mhm.
Should dissection survivors expect a normal lifespan?
Yeah.
Dr. Prakash says, in most cases, yes. Yes, we are just reaching the point where we now have proof that lifespan can be normal with lifelong follow-up and careful surveillance.
Yeah. It's
And
true.
and and live your life as you normally would. Yes, we do have restrictions. I'm saying that's not him. We have
Uh-huh.
restrictions. We know we have restrictions, but there's no reason we can't live our life. I actually feel like I have a better life now than before I dissected. I really do.
Well, and I think that when they ask about normal lifespan, I don't know. Yeah, whatever normal is supposed to be for you, does
Correct.
it any of it matter? Because like the old adage, you could walk out right now and get hit as you're crossing the street. Is that part of
Exactly.
the normal? Yes, because that's part of whatever your lifespan is supposed to be. I don't know that I believe that things are predestined. I sure hope not, because boy, I don't know how many more cat lives I've got, but
You and
you
me
know,
both.
it's just how life happens.
Yeah.
So 5 years ago, well, no, 10 years ago, um, and older, when you came into this community, you were told after a dissection, not after being diagnosed with AD, you were told that you'd be lucky if you made it 5 years. Forget
Hmm.
forget 10. Because here's the main reason where everybody starts asking this question. Because years ago, people really only focus their attention on following up people with known connective tissue disorders, Marfan's, Loeys-Dietz, vascular Ehlers-Danlos. I mean, I don't even know if ACTA2 was discovered 15 years ago. I don't know. It's only been in like the last 2 decades for that. Turner syndrome, which is chromosomal, but still, and that's only in women. Those people were always actively monitored. But the rest of us, people who just had a dissection because we were in a car accident or because we didn't know that we had a family history, we didn't know we had hypertension, whatever the case is, we were like one and done, go home, you're fine, live your life. Nobody
Exactly.
anticipated that we would develop aneurysms just like anybody else. So that's why we were dying. And then one day the medical community realized, wait, maybe we should monitor these people just like we do the others.
Hmm.
And then our lifespans increased to
Correct.
normal. Normal,
Whatever that may be.
whatever it
Each
is,
person's different. Exactly.
pretty much. You want to take the
Yeah.
next one? You want me?
Sure. No, I got it because I like this
Okay.
one.
I'll take the one
Is
after.
okay. Is exercising, doing any activity in altitude that you
Mm,
are not used to, causing you to fatigue, t- to exhaustion, a no, or as long as you are stopping and resting before carrying on, okay? Could such activity in altitude really be raising blood pressure more than one realizes?
mhm.
Dr. Prakash says yes. Always acclimate for at least 48 to 72 hours at altitude before attempting to exercise, especially if you have an aortic disease. Altitude causes stress on your body that raises blood pressure and also makes routine activities more challenging than usual. It is important to modify your activities to start at a lower intensity and ramp up more slowly than usual so that you do not fatigue quickly when you start to exercise at altitude. That makes so much sense. And you really don't realize that altitude really affects you until you're in the altitude.
Well, and so one of the things to remember, people will often say, can I go to a higher altitude? And the answer is people live in higher altitudes with
Correct.
aneurysms.
Correct.
And it's not because they're acclimated, it's because that's where they live. So yes,
Correct.
of course you can go there. It's not like you're going to spontaneously rupture.
Combust.
When you're in an airplane traveling there, you're already at uh um
34,000 feet.
well, it's 8,000.
Oh,
You're pressurized at 8,000, I
oh,
believe.
right,
But
right,
yeah, I
right.
mean, you're much
Right.
higher than 8, but you're pressurized to feel like 8. So when you go to any high altitude, like he said, regardless of aortic disease, you need to give yourself about 2 to 3 days. You need to super hydrate. I would never recommend drinking alcohol because it's going to give you a headache. More than likely,
Hmm.
I'm not a doctor. I'm just saying from experience, not mine, but watching people, you will yeah, you're going to feel nasty. And that's why they have these whippets of oxygen in like Colorado at high altitude
Hmm.
hotels that you can just get and take a quick couple hits of pure oxygen because it's so hard to acclimate.
Hmm.
It's called altitude sickness for a reason.
Yes.
Um, and your body's naturally just going to move slower. It's going to tell you what you need to do and how to do it. But don't plan a hike the day you arrive or the
Yeah.
next day or a marathon. Like acclimate and then go live, go live your day and your time there.
Correct.
All right. Here's a controversial question I'm not going to read because we didn't get an answer yet. All right, let's go. Find another one that we have an answer. Let me refresh here real quick. That
uh,
stopped me in my track. All right. Let's see what we got. Okay. So we are at newest. All right. Let me go down past that into some of the others that had already asked. Okay. Um, no, we're gonna go to the next one. So this
yeah.
person's been told that to pre no, we already talked about it. What's the difference between something being being hereditary
Did he answer
versus
this
a
one?
genetic issue? Um, your father had undiagnosed dissections, so that is most likely why I dissected. But what is the reason that it happened to both of us? Is it a gene? And the answer is, for all practical purposes, hereditary and genetic are the same. So it doesn't
Then why
matter.
did you make me type that question?
Because I didn't know the answer.
Oh, did
Did
he
you
already
know?
reply?
Yeah,
No, did he?
that's what he said.
Oh, I didn't refresh. I'm
That's not
sorry.
me. That's
I'm
him.
sorry. I didn't refresh.
All right, here's another one. All right, unfortunately, this person that wrote said that their brother passed away at age 29. He was in the ICU for 3 weeks and was moved to a step down unit for 2 days as his surgeon said his condition seemed to be improving, even though he was not awake the entire time. On the second day at step down unit, his condition deteriorated
Uh,
and they moved him back to ICU. They couldn't figure out what was the cause, and I implored his care provider to look into sepsis, but he was adamant it was not sepsis. And the brother was in the ICU for another 2 days before he passed away. When I looked at the cause of death after his burial, it said sepsis. And I was shocked and angry. I failed my brother. What is the proper recourse? We're not from the US. That's going to be a challenging question. But it is not appropriate to provide medical critiques on this forum. You are asking for advice that is beyond the scope of what I can provide. I'm sorry for your loss. And that is true. It's really, especially if you're asking for something that didn't happen in the States, to
Hmm.
understand how to handle something possibly legally in another country is really, that's a tough one. It's tough.
Yeah,
That's just tough to listen to all around. Yeah, that's
it is.
hard.
Yeah, and
It's
as soon
hard to
as I
even
heard that,
speculate. Yeah.
yeah, I was like, that sounds more legal than medical, and
Yeah.
yeah,
Yeah.
that's opening a whole
It's a
nother.
lot of case, a lot of paperwork and
Yes,
records you'd really need to read. But here's
yes.
one. This gentleman's wife's giant cell aortitis, which I would love to learn more about that, was diagnosed after her arch was repaired with FET. I can't remember what that means.
I'll
Descending
look it
aorta
up.
has been stented to just above her SMA. These are all locations in different zones of the aorta in two additional procedures. She's having trouble with blood pressure, isolated systolic hypotension. Is that common? Never had hypertension. Maybe he meant to say hypertension. Hypertension isn't good for aneurysms, we all know, but it's baffling, her cardiologist. And Dr. Prakash says changes in blood pressure after aortic repair are very typical. Blood pressure can change in either direction due to inflammation that results from the operation itself and lingers well after surface healing. I did not know that. Frequently, we make extensive changes to medications after the aortic operations and have to follow patients closely with additional adjustments for up to 6 months. After then, blood pressure and heart rate will usually stabilize.
I always tell people when they ask me, or they like, well, how did you deal with this? My blood pressure's up. This is happening. My
Hmm.
medications aren't right. They keep switching them. And I actually think it was you that used the word that the doctors have to find the right cocktail of medications
Yeah,
that work best for you, because everyone's going to react differently. I know what I take doesn't work for Karen, and what Karen
right.
takes probably won't work for me. So
Yeah.
it is very important. And it's true that you have to give it time, and that it's got to be the right cocktail.
The other thing too is these pills can't be taken like a Tylenol. They don't
Right.
work in 20 minutes. They
No.
sometimes take 2 hours to work, 4 hours to work. And sometimes you're really never going to have the full effects until you've been on them 2 to 6 weeks. So
Correct.
you might be having this initial reaction because your body's like, anything else, you're putting something in it and making it do something that it's
Hmm.
never done before. And you're still trying to live your life, and you might be working against a medication that's lowering your heart rate, so you're trying to be active and you can't understand why you're exhausted because this medication is preventing your body from being the way it would be if you were active, et cetera, et cetera. So, I think a good rule of thumb for you guys, for patients, would be to keep a log in those beginning years, or even when you change medications years later, in those beginning stages. Write down, and there is space for this in the book, but you want to write down the times that you're taking your medications, what your blood pressure is at those times, so your physician can see how well it's affecting you over the course of a day. Should you be going from 3 times a day down to two? Should you be going from two up to three? And explaining your symptoms, because there's categories and classifications of drugs, but if there's 4 or 5 actual drug brand names in that classification, they do
Hmm.
not all affect your body the same way. Yeah, I cannot tolerate losartan. I just cannot, but I
See,
can
and I take
tolerate
it. I
Nebivolol.
take right. I take Losartan twice a day.
Right.
Doesn't bother me.
I was on 900 milligrams when I left the hospital a day.
Yeah, it wasn't on that
Yeah.
much.
And now I'm down to 15 milligrams a day of Nebivolol, which is still a LOL, which is a beta
Hmm.
blocker, just
Right.
impacts me differently. So everybody
Hmm.
responds differently.
Right.
All right, here's that controversial question. Are there any diets that fix connective issue? Tissue issue. I threw in the word issue. I'm a carnivore. Me too. I'm a carnivore. And it helped her tremendously. So if doctors can cure cancer with that, can carnivore help here too? This is valid question.
It is.
And the answer is certain dietary principles help. Here's one. After aortic operations, adequate protein intake is important to promote wound healing and muscle strength recovery. This I know because my home health care nurse would come in and ask me how many portions of protein I was having and would make me eat peanut butter right in front of her. She's like, if
Wow.
you eat nothing else, eat protein. You don't need mashed potatoes and you don't need rice. You need protein because it does help things heal. So,
Hmm.
isn't that interesting? Number two, a varied diet rich in antioxidants has been increasingly recognized to reduce vascular inflammation. We now recognize that chronic inflammation drives the growth of some aneurysms and can cause aortic dissections. Isn't that interesting?
That's very interesting.
It's
But
very interesting.
the protein thing is so true. But
Yeah,
protein is good for everything.
of
Like,
course.
I've
Yeah.
been told I'm not eating enough protein and I need to eat more so that I can lose weight. Well, that's counter to me, that is contradictory. How can
Hmm.
I eat more and lose weight? But it's protein. Protein is good. The
Yeah,
right kinds of protein is good.
totally true. Yep.
Yep.
All right, are we missing anything here?
I think we've
Dental cleaning,
gotten them
vasculitis.
all.
Uh, okay, I think we
I think we
did.
got them all. Think
You know
so.
what? It's time for
A
another. Do, do,
commercial.
do, 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 do. This is our seatbelt covers. It is different from the ones we had, but it is great nonetheless because differences and change can be good. It's cotton. And this is what I love about this. This is breathable. I'm not going to say anything positive about this that negates the one we had. Listen, it comes down to price and cost, everybody. And unfortunately, the ones we had, they outsourced their product and the cost almost tripled. So it was no longer effective. I was not going to pass down that to all of you. So we went with a different brand, another heartfelt story, an individual who is deaf that created these. Originally, they're called pullover pals, not help belt seatbelt. That is the name of the prior company. This is a pullover pal, and originally it was a product that was created that if he got pulled over or he had an emergency or a situation, he could flip this outside of his window and hang it so somebody could say it read, "I'm deaf." Just heads up on how we're going to communicate. Just kind of like take a step, take a minute, and we'll figure this out. And then it turned into these belt covers, which is, applicable to anybody. So this belt cover Velcros, it's so easy to go on your seatbelt. And look at that. It's got this plastic pocket in here that holds a card that comes with it. And on this card, it says your name, your emergency contact, your allergies, medication, blood type, additional information, and there's room on the back. So you just basically wrap this around your belt and Velcro it shut, and that's it. And you can use it on your seatbelt. You can use it on a dog leash. You can put it on a bike's, bar. You can put it on a backpack if you're
This
taking
is
a hike.
backpack.
And
And
these come in black or red.
how much are
And
those? Because I need a new one.
$18. That includes shipping. So it's
Cool.
18 domestic, 23 international, which is a steal considering how much shipping can be internationally. But these come in two sayings. You can choose aortic disease or you can choose um, medic alert. Medic alert's great. Like tell your friends and family that have other conditions outside of aortic disease because they could grab one too. And red or black were the community's favorite colors when we were offering red, black, or yellow. So because those were the top two colors, we went with those as your options. And quite frankly, we used to offer aortic dissection, thoracic aortic aneurysm,
It was a
abdominal
lot.
aortic aneurysm, and it's like they're all aortic disease. So what does it matter?
Right.
You
I
know?
have a thoracic and I have, you know,
Dissection.
ascending. So,
Right.
right.
So
Um,
yeah, I can show you
the
the
other
black.
thing too
Uh-huh.
is you should get one for every car in your house. Like, we are
Yeah.
three people, we have three cars, and I'm in any one of them at any time.
This
I
is
really
sharp.
like the black.
It
It's very
is.
sharp.
Yeah,
Yeah.
right. It's totally super
Yeah.
sharp.
Yeah. It
And,
really stands out.
women with our makeup, it does tend to drop and you just take a sponge and go whoop, that's it.
Yeah. I think
Super
I'm gonna
simple.
order black ones.
I think I don't have to ship it to you. I think I can hand you one once I know you've made your payment. Once I know you're good on that.
Exactly. Yeah.
All
That's
right,
fine.
let's check in and let's see where we're at here. Okay. Gosh, the numbers just keep going up. I love that. I love that everybody's commenting. This is so great
Yes, that's
because
great.
we get to learn. We get to like, be
These
community
are
members.
I was gonna say this is very nice. You definitely get to learn.
Yeah. Oh, wait, that's two new ones. Three new ones, four new ones, four new ones, and
Yes.
no answers just yet. So let's talk some more.
Okay.
Hey, you know what? This is very exciting. I don't even know how many new people are watching. Did you guys all realize, where is it? That I'm sure you must all know by now that we had published at the end of 23 Aortic Dissection, the Patient Guide. Do, 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 do. So this is a guide that is written by patients, meant for patients. It's very colorful, super easy to read. Even though this was written by patients in the UK and Ireland, and then we got to take it here to the States and we gutted it and we rewrote the whole book, it's been clinically reviewed by numerous doctors, and all of their names are listed. You may even recognize one as your own doctor. And then it was given a seal of approval. It was endorsed by the Society of Thoracic Surgeons and the Society for Vascular Surgery, the two big ones here in the United States.
Mhm.
They took a look at it and they loved it, and they put their stamp of approval. So this is available for free download, and for bulk orders from your physicians, they get boxes of 25, and you can also order a single individual hard copy. Although I would prefer you to say something to your physician and get them to order a box of 25. And look, I'll send you one also. I'll send you an extra one. But we're just trying to move this across the country. And I will say that we've had probably close to 10,000 downloads at this point, which was 8,500, I think, between downloads and hard copies were done within the first year. So
Mhm.
it's crazy how it's not crazy. We knew this, how popular this book was going
Why
to
we
be.
did it.
Yeah, and the just the comments alone on,
Mhm.
if we'd had this when we first dissected, how much easier recovery might have been. Um, but the exciting news is aortic disease, the patient guide, is going to be available. We really feel confident before the end of first quarter. We're in our final stages of editing right now, adding pictures of community members and quotes that people have submitted to us. And then we're going to do our final pass through and then go ahead and try to get the endorsements, and then it's done. And that'll be ready as well for you guys. So it's a great gift. I mean, aortic dissection, so important to have if you've had a dissection, but aortic disease is going to cover aortic valve disease,
Mhm.
regurgitation, stenosis, bicuspid, right, which is hereditary as well. It's going to cover um, aneurysms, starting at the root and heading all the way down through the abdominal area. And of course, it has to cover um, a touch of aortic dissection, because that's part of the disease element. Genetics, support information, diet, exercise, mental health. It's all in there.
Mhm.
Again, written by a different group of patients this time, and some caregivers and some medical students, reviewed by a few different new physicians for us, and it will receive those endorsements. So it's going to be designed a little bit differently, but kind of similar. Does that make
Yeah.
sense? Right.
Yeah, no, absolutely, and it really was amazing. I read one of the first drafts, to get, some input and what I thought, and it was so enlightening to learn. Okay, so yeah, I know about my dissections. I know what that is now, but to learn all the other stuff that is out there that anybody could have, that, aortic disease
Yeah.
is different, is something that can happen in several different ways. So,
Yep.
it's definitely can't wait to read the whole thing again.
Okay. Seeing if we've had any Oh, well, remember we had the question just now about protein. That community member wrote specifically for you, Terry. Protein can raise your glucose levels if you eat too much of it. So it's called
Correct.
gluconeogenesis. All this person eats is protein and fat, but it's a balance. So I guess you have to have a good amount of fat
Correct.
to balance your protein,
Correct.
but
Absolutely.
something you should talk to your physician about. Um, Still waiting for some responses. We've got a couple we've got to answer. We've got like at least a couple. So we're getting there.
Yes. Yeah.
He's catching up. Maybe he had
And
to eat a quick bite for Din Din. Who knows?
not even that. This is a lot of information. And, he's a smart man and he's amazing. But I just
It's a
to
lot.
type all this, it's like, it's a lot. It's a
A
lot.
lot.
And
It
it's
is a
very
lot.
impressive. And it's
Yeah.
it's it's great that he does this for us.
He's been doing this. This is what, 2025 now. So
Yeah.
it's almost been 7 years.
I was gonna say this
Because you
was
know how we met
before I
Dr.
my time.
Prakash? We were invited back in 2018, um, bef- early in the year. We were invited to speak and have a presence at John Ritter Foundation. Uh, it was a symposium that they had. I wasn't aware if they had symposiums before that, but they had had a symposium in Washington, and oh my gosh, that lit a fire underneath of us, and we were like, we've got to get our 501(c)(3) in place. We've got to get a website. Like we got to pull this together. We didn't want to just be a Facebook page. Nothing wrong with Facebook pages. Very different from being an organization with policies and procedures and all of that. So we got our act together. We had done enough GoFundMe's. We had the funds. We became a nonprofit. We did everything. And I remember I was asked to speak. So number one, I'm so nervous because I'm like going to be with John Ritter Foundation. What does that mean? And I have to speak in front of people, which my parents came, my sister and brother-in-law came, my niece, my son, like it was not a dry eye in the house. That was me telling my story. That's when I met a couple community members for the very first time. And it was so surreal to like touch. It's a very strange thing, I feel, when you meet somebody that's been through what you've been through and you place hands on them. There is in that moment, there is nothing politically different or aligned between the two. There's nothing religious, spiritually aligned or different. Nothing. There's just nothing.
Totally
But
agree.
this connection of having our hearts turned off. And now I even still feel a connection with people who have been diagnosed with aneurysms, maybe because I have too. But you know you're on this path of major ebbs and flows. And you can now almost just look at somebody and it's like, I got you. And I know you
Hmm.
got me. Like, this is going to be
Hmm.
tough sometimes. And sometimes it's not. And it's just I never felt that with the Crohn's group people. They were lovely, let me say, but it was just different. It's different because even though this is very different too, Crohn's and colitis world, it's just there's a lot of similarities in stories with a little bit of nuances. Here, there's so many differences
Hmm.
underneath of an umbrella. So it's the opposite. And when you're very similar to people, it would be like a group for people who broke a toe. Like or a thigh bone, right? That's it's gonna hurt. But y'all broke a bone. We all know what it feels like, and we know what the cast is like. It's like, well, there you go. Unless it caused something major, hugely different, we all broke bones. But this is like we all know our hearts were turned off, and we all know we're lucky that they got jump started again.
Correct.
And it's just kind of like you feel somebody else's energy, and it's like you're kind of the same. Do you know what I mean? It's like
Hmm.
I'm getting all
Absolutely.
existential. I think I need more Doritos. Okay. I hope I
Well,
can
we got a
sleep
few more
tonight.
minutes. We got a few more minutes, and then you can go eat your Doritos,
All
and
right,
I'll
let's
go eat
I'm
some
not really
protein.
eating Doritos, anybody. I'm really not. Do not pay attention to the person behind the curtain. All right, here we go. Here we go. I've been that was did we talk about no, we might have talked about that one. Let's go to newest. Okay. Mm, okay. Nope.
No, he hasn't replied.
No,
He might
no.
be busy.
Could be busy.
Yeah.
Well, yeah, you guys, we've got a couple really interesting questions, such as husband was just released from hospital after a planned open abdominal aneurysm surgery on January 9th. That's like 5 days ago. He's
Yeah.
complaining about low back pain. He said probably due to bed rest for too long. Spouse not too sure. Just want to know if they need to be concerned if it's anything serious. I did see this question come up on one of the other page. It could have been our page, but I read these pages before we come on here, and I can't wait to hear his question. I mean, obviously, if anything is, um, you know, you're really, really concerned, then
Call your
you should
doctor.
call your doctor, of course. But
Correct. Yeah.
I can just say there's nothing worse than trying to move after you laid in bed. The stiffness that you feel after any kind of surgery, C-section, anything, anytime anybody messes around and moves stuff around in your body, you're going to feel it in your back because your back takes all of that brunt from the muscles that you're not really using the same way that are in your stomach. So your arms, how many people that had a dissection complain that they had pain in their one of their arms or numbness or shoulder pain. Right. When it's an emergency, they just flop your arms out on the table. They
Hmm.
don't care. So when you have an open abdominal, you are cutting through so many layers of muscle. And my personal experience, and not a physician, I have had 4 bowel resections, an ostomy surgery, a C-section that had to be reopened because of an infection, and a gallbladder and an appendix. I don't know, I lost count, 6 or 7. You are never the same. Just take one. And the pain from having all those muscles cut through is so gut wrenching on your back. It radiates straight back because you're not using your muscles the same. You can't cough correctly. You're putting a lot of strain on that back. So I would almost venture to say, is the pain radiating to the same spot in the back? Still check with your doctor, but I feel like that's something that we hear that's kind of common, but it's always scary, right? It's always scary.
Absolutely. It's always scary.
Yeah. Um, okay.
Any
So
pain you
we,
feel that you're not used to is going to be scary.
of course, of course. That was a question that came in twice. Okay.
Yeah, I
So
saw that one.
I think I'm going to take off one of these real quick so that it's only on once. All right. We've got, can ankylosing spondylitis be a contributing factor to an ascending aortic dissection? And I'm not a physician, but I'm going to just shoot in the dark here and say yes.
Yes, I knew you were going to say that.
Because we've got community members that have AS that have aortic dissections they've experienced. So
Yes,
they
we
have
do.
aneurysms too. And
Yes, we do.
AS, it's an autoimmune deficiency. It creates inflammation in your body. Inflammation markers go high, your heart works harder to get rid of inflammation. Whether that's the connection, I do not know. But there are people with Crohn's disease that have AS. It is not a guarantee that with AS you'll have Crohn's. Just you see the difference. So, and I know quite a few patients that have had a dissection and have had aneurysms that have Crohn's disease. It's all inflammatory. I think it's all
Mhm.
probably connected somehow, but I can't guarantee because I'm not a doctor. I just play one on TV.
I was you just beat me to it. I was going to say that. I
All
was
right.
exactly going to say that.
Listen,
It's
I'm
seven.
doing one more pass through.
Yeah, it's 7:30. Do we have
I
one more
know.
commercial?
Um, you're catching me off guard. I'm looking around. Oh, yeah, no,
Actually,
I got a commercial for you. Wait, I'm just checking. Da,
well,
da,
while
da.
she's
We've got
talking,
some really good questions coming in. Oh, I just can't wait to know. I want to know. All right. So, you guys, I'm going to show you a couple really cool, fun little things here. I'm going to tell you a story, a bedtime story. Let me see what I got. I'm not going to show what's coming out this year. That I'm not going to do. All right. In my bag of goodies, I'm not, can't show that. All right. I'm so into ASMR that just opening drawers right now is giving me tinglies because I love TikTok when people open drawers and open packages. Oh God, it makes me so happy. All right. About, let's see, what was it? 2016, 17, when the aortic coat first came. And it was like a creation, a thought, whatever. We were a Facebook page of quotes. I was really bored and I decided to knit this little teeny knitted pillow. I took up loom knitting.
mhm,
And somebody in the community was having aortiversary. I'm like, I don't even know what that is, but okay, that sounds kind of cool. What's your address? I'm just going to send it to you because what am I going to do with it? And I sent it to her and she loved it. And she took pictures and showed it to everybody. And then I got requests. Can you make me one? Can you make me one? I'm like, I don't even remember how I made the first one. I have to find the YouTube video. But sure, I made a couple of these pillows. And then I thought about it and I was like, I am not going to be the like 46-year-old like knitter. That's not happening. I need a different hobby. So we did a GoFundMe, we raised some cash, and then we bought items, and Hope Mail was born. So Hope Mail went from having one person to 32 recipients to now over 300 plus recipients. And what it is you can sign up for Hope Mails underneath of our programs across the tab on our Facebook page, and it's free. It's free. And what this means is you're going to fill out a form and you're going to tell us your aortiversary. So either the anniversary of your surgery. Look, if you've had more than one surgery,
pick one.
pick a date though. You can't use both, right? And if even if you haven't had surgery and you're just waiting, you've been diagnosed, that's fine too. You can just pick that as your date. But if you have surgery, write us please and tell us, and we'll change the date. info@aorticope.org. I think we've gotten some answers. But yeah, so you will receive a couple items from us as an acknowledgement of your aortiversary with a handwritten note. And I don't know how well you're going to be able to read if notes come from me, not very legible. Other people, very legible. Um, and these items vary. So they're usually based upon theme. But when we first started off, we had our stress balls and we had keychains with flashlights. And we've one year we had these are magnifying glass bookmarks. Another year, last year, we did an emotional mental health, and people wanted something from mindfulness. And so we sent out these full 8.5 by 11 size coloring
Coloring books.
guides, right? They had mantras in it for adults and a little
Hmm.
pack of pencils. And we had a little fuzzy calm strip that you could put on the back of your phone.
Oh, I don't
Yeah.
have one here. Yeah, I was
I
looking for
don't,
a
I
cut.
never asked for one because the idea of rubbing that, I don't like, I'm a tactile person. I
Well,
don't like touchy.
I was
I
looking
don't
for one of the
touchy.
color. I was looking
Yeah.
for one of the coloring books, but they're in the other room.
Oh, I thought well, I don't know what I have in this room, but it's very touchy and I didn't like them. A lot of people liked them. So the point is we change up our products. We might get a chapstick and something else. Could be a hot cold pack. Like you never know what you're going to get. And we change them every year. So we did change them for this year. This year, because our focus is on how to ace your healthcare journey by advocating, communicating, and educating, we did try to come up with ideas of items that we felt could enhance that journey for you, and you'll have to sign up to see what you get. But I'm pretty sure it's 3 items.
It is
Three
three
items this
items,
year. It is
and
three
I just
items.
mailed today. I sent out January's, and I sent about 25 of them. So
Yeah. And listen,
it's
if you
fun.
guys move, please email us at info@aortacope.org and tell us,
Yes.
because you know what happens? These items get shipped back. They get shipped back to me. I said shipped. I swear to you, I said shipped. These items get shipped back to us, and then we just delete you off the chart because there is literally
Yeah.
no time to reach out to all of you and figure out how to reach out to you to say, oh, your item got shipped back. So if you don't get one and you know you signed up, sign up again. And if you're within the month and I can get you one and there was an issue with the post office, I'll be more than happy to. But if you move and you don't tell me, then how do I know where to send it to? I do not know. And then you
Info
miss
at
out.
aortacope.org. Info
That's
at
right.
aortacope.org. There's
Tell
several of us
us,
that see that email.
okay, we've got answers and then we're going.
Okay.
Because you know what? It's going to be like Real Housewives time.
I know.
Okay. I know.
I
It's
haven't
like a new night.
I haven't talked to my husband at all since I've been home, so I
Well,
definitely need to do that too.
that would be important. All right, we just talked about the person whose husband just had an open abdominal aneurysm surgery. I feel so bad. And this is what the doctor had to say about that pain. So again, please report any new pain that is not immediately explainable to your surgeon. Something that he did not feel in the hospital and now is feeling since he's home. You gotta say something. It's always a good idea to keep your surgeons informed, even if you think it may only be low back pain or radiating pain. Emergencies are rare after surgery, but if it is causing your husband distress, that's also worth mentioning because distress creates what?
High blood pressure
Exactly.
and anxiety and yep, not good.
Not worth it. It's not
Not
worth it.
no,
Not
it's
worth
not
it.
good.
Um, Ankylosing spondylitis. Can it be a
Yeah,
contributing factor to ascending aneurysms?
absolutely.
Absolutely. That's right. Aortic
Wow.
dilation is quite frequent in patients with ankylosing spondylitis. While aortic dissections are rare, aortitis and an autoimmune inflammation of the aorta can occur in AS patients, and it's
Wow.
been associated with aneurysms. So yeah, for all of you AS patients, you probably need to add a really good cardiologist that understands aortic disease and add that person to your AS team of doctors. Okay. Where are we? Do we have any others?
No, but there's another question that's interesting. It was similar to what oh, never mind. Never mind.
Did we already answer it?
No, we didn't answer it. No, it is similar. It's similar to what you were talking about,
Okay.
about, the AS, it causes, most people have aortic dilation. You were also talking about the Crohn's and things like that. So this
Mm-hmm.
one's is 10 months out from A and B down to the right iliac. Last week
Okay.
I told I have ischemic colitis on my right side of colon, common on a couple antibiotics right now. You were just talking about that, something similar to that. That some things go with other things, unfortunately.
Oh yeah. Oh, I just see it here. Right.
Yeah.
What was his answer again? Yeah. Oh, ischemic colitis is fortunately rare. Right.
Yeah.
What that means is that blood flow to part of your intestine has been cut off. That is not a common occurrence
Okay.
with colitis in general. That really doesn't. I mean, you can have blood flow be cut off if you have a lot of scar tissue or adhesions, I think, but I don't. Maybe not even. I mean, this is a whole different type
Okay.
of situation. It can be due to changes in your blood flow after your dissection. That seems more likely that your dissection, maybe you have a false lumen that's trying to feed into that area. And that would be like coming off your celiac artery. I'm not a doctor, but I did memorize the zones. I'm sorry, I kind of did the other day. But if it's a new change for you, Dr. Prakash recommends that you please let your aortic surgeon know, let your specialist know, because you might need additional treatments to help stabilize your aorta. So that's important. That's really, it's a good question.
Yep.
Um, I mean, missing anything else, or are we about to say goodbye?
I think we're
Goodbye,
done.
goodbye. I think we are. You did a good job.
You do too.
Thanks, hon.
You are amazing, and you're amazing.
Thank you. So are
You're
you.
quite well. Thank you so much. That's why we make such a great pair.
All right. To all of you paying attention here, we thank you so much for all of these questions that you chatted in. We really appreciate it. We love that you utilize the um, anonymous form. Yay, you guys, for doing all of that work. And if you have a question, it's been dropped in our chat on YouTube. It's been mentioned on Facebook. Please go check it out. He's going to be still writing for about another half hour to an hour. He will answer these questions. And if he doesn't get to tonight, he's pretty good
You
about
will.
trying to check in tomorrow. So I
Yeah.
appreciate all of your input because I love learning something new. I do every single time. I get to play patient, and I love that. It's so important to me because I'm a patient just
I
like
was
you,
gonna say
actively being
you're
scanned.
not playing a patient. We are
I am
patients.
a patient. I don't play one on TV because I
No,
am
you
one.
really are.
I really am.
We really are.
I just had my scan. Yeah, I got to go back in 6 months. But before we go, we want to remind you, just go ahead and click like. Just if you like us, click like. Hey, if you love what we're doing, there's a donate button down there. I never mentioned that one, but thought I'd throw it out today. Let's start the year off really well. You can always
Mhm.
click that too. But more importantly, click subscribe. Click the bell so that you're notified when we go live, like tomorrow night for Aortic Artists, where we're going to have a ton of fun with your hostess with the mostest, Terry, and Diane Bishop from Aortic Health Unlimited. And click share because honestly, sharing helps your friends and family better understand your condition if they get to read
Sharing
some of these
is
questions. And
sharing is
caring.
caring.
And Karen is the majority of the word caring. Just thought I'd throw that out there. Uh, yeah, I had to have a
Oh
whole
my gosh.
discussion with somebody about Karen, and I had to tell them it's really I'm not Karen.
KAR.
Like I'm not being a, like no. Corinne. My name's Corinne. Let's just go because I had to make a complaint, and I hate making complaints. Use them very sparingly, or I make up a new name when they want my name. I hate that. God, couldn't have there been a love song about Karen by Rick Springfield? Hey, Rick, if you're watching, that would be really lovely. All right. Anyway, you guys, just click like, click subscribe, click share, please. Someone's going to get something out of this, and it's going to be very
Mm.
important to them. And thanks again, Tara. Thanks, Joshua.
Thank you,
Appreciate it.
everybody. And thank you,
Have a
everyone, for
Thank you,
logging
Dr.
on, for looking.
Prakash.
Yes. Thank you,
Thank you, Dr.
everyone.
Prakash. All right. Have a great night.
Bye.